Thank you for joining us for this briefing on the Hantavirus situation. Let me begin by outlining what has happened, what we know, what we don't know, and what WHO has done. Last Saturday, the United Kingdom notified WHO under the international health regulations of a cluster of passengers with severe respiratory illness on a Dutch-flagged cruise ship, the MV Hondius, which had traveled from Argentina to Cap-Vert. So far, 8 cases have been reported, including 3 deaths. 5 of the 8 cases have been confirmed as Hantavirus, and the other 3 are suspected. Hantaviruses are a group of viruses carried by rodents that can cause severe disease in humans. People are usually infected through contact with infected rodents or their urine, droppings, or saliva. The species of hantavirus involved in this case is the Andes virus, which is found in Latin America and is the only species known to be capable of limited transmission between humans. In previous outbreaks of Andes virus, transmission between people has been associated with close and prolonged contact, particularly among household members, intimate partners, and people providing medical care. That appears to be the case in the current situation. The first case was in a man who developed symptoms on the 6th of April and died on the ship on the 11th of April. No samples were taken, and because his symptoms were similar to those of other respiratory diseases, hantavirus was not suspected. The man's wife went ashore when the ship docked at the island of St. Helena and was also symptomatic. She deteriorated during a flight to Johannesburg on the 25th of April and died the next day. Samples were taken which were tested at South Africa's National Institute of Communicable Diseases and confirmed as hantavirus. The third death was of a woman on the ship who developed symptoms on the 28th of April and died on the 2nd of May. Another man presented to the ship's doctor on the 24th of April, and he was evacuated on the 25th of April from the island of Ascension to South Africa, where he remains in intensive care. Doctors from Cabo Verde boarded the ship to provide care for the 3 other passengers with symptoms. WHO coordinated their evacuation to the Netherlands for treatment. I would like to thank Prime Minister Ulisses Correa e Silva of Cabo Verde for his support in facilitating the evacuation of these 3 patients based on our request. 2 are in a stable condition in hospital, and 1 is asymptomatic and is now in Germany. The 8th case was in a man who disembarked in St. Helena. Following advice from the ship's operator, he reported himself with symptoms in Zurich, Switzerland, and was confirmed yesterday to be infected with hantavirus. The Geneva University hospitals then sequenced the virus and confirmed it as Andes. None of the remaining passengers or crew on the ship are currently symptomatic. WHO is aware of reports of other people with symptoms who may have had contact with one of the passengers. In each case, we're in close contact with the relevant authorities. Given the incubation period of the Andes virus, which can be up to 6 weeks, it's possible that more cases may be reported. While this is a serious incident, WHO assesses the public health risk as low. It also shows why the international health regulations exist and how they work. WHO is working with multiple governments and partners on the response under those regulations. Our priorities are to ensure the affected patients receive care, that the remaining passengers on the ship are kept safe and treated with dignity, and to prevent any further spread of the virus. On Monday, I asked Prime Minister Pedro Sanchez of Spain to accept the ship, which he agreed to do, and I thank Prime Minister Sanchez for his generosity, solidarity, and meeting his moral duty. The ship is now sailing for the Canary Islands, and we're confident in the capacity of Spain to manage this risk, and we're supporting them to do so. Once again, we assess the risk to the people of the Canary Islands as low. WHO has provided guidance to the ship's operator on the management of health on board the vessel. All passengers have been asked to stay in their cabins. The cabins are being disinfected, and anyone who shows symptoms will be isolated immediately. A WHO expert boarded the ship in Cabo Verde and has been joined by 2 doctors from the Netherlands and an expert from the European Center for Disease Prevention and Control, who will stay on the ship until it reaches the Canary Islands. They're conducting a medical assessment of everyone on board and gathering information to assess their risk of infection. WHO is developing step-by-step operational guidance for the safe and respectful disembarkation and onward travel of passengers and crew when they arrive. WHO has also informed 12 countries whose nationals disembarked in St. Helena. Those 12 countries are Canada, Denmark, Germany, the Netherlands, New Zealand, St. Kitts and Nevis, Singapore, Sweden, Switzerland, Turkey, the United Kingdom, and the United States of America. In addition, WHO is supporting health authorities in South Africa to follow up people who were on the flight from St. Helena to Johannesburg with the woman who later died. Meanwhile, investigations into the cause of the outbreak are continuing. Prior to boarding the ship, the first 2 cases had traveled through Argentina, Chile, and Uruguay on a bird-watching trip, which included visits to sites where the species of rat that's known to carry Andes virus was present. WHO is working with health authorities in Argentina to understand the movements of the couple, and I thank the government of Argentina for its cooperation, given its experience and expertise with Andes virus. We have also arranged for shipments of 2,500 diagnostic kits from Argentina to laboratories in 5 countries. I would also like to thank the governments of Cabo Verde, the Netherlands, South Africa, Spain, and the United Kingdom for their close partnership and support. I also thank the many partners who have provided expertise, including the NICD in South Africa, the Institut Pasteur Dakar in Senegal, and the HUG here in Switzerland. And I would also like to thank the ship's operator for its cooperation and the passengers and crew who are going through a very difficult and frightening situation. I have been in touch with the ship's captain regularly, including this morning. He told me morale has improved significantly since the ship started moving again. I thank him for everything he has done to protect those under his duty of care. WHO will continue to work with all relevant governments and partners to provide care for those who are affected, protect the safety and dignity of passengers, and prevent onward spread of the virus. Christian, back to you.
Thank you very much, Dr. Tedros. With this, we come now to the rounds of questions and answers. Again, please identify yourself clearly. Raise your hand if you want to ask a question. Then unmute yourself if called upon, And please also take down your hand in case your question has been asked and answered by one of the colleagues. Now, the first question goes to Spanish news agency EFE, Antonio Brotto. Antonio, please go ahead.
Thank you, Christian. My first question is, in Spain, the central government and the regional authorities of the Canary Islands remain divided about the issue of the ship's stopover. So could you indicate what assurances the Spanish government has provided and what kind of assistance the WHO will provide once the ship arrives to Tenerife in this weekend? If I may, I have a second question about this Dutch stewardess that has been hospitalized today in Amsterdam. Do you have data on this case and how she may be infected? Did she travel in the same plane than one of the deceased from St. Helens to Johannesburg? Thank you.
Thank you very much, Antonio. With the first question, we go to Dr. Abdi Mahamoud, Director Health Emergencies Alert and Response.
Thanks so much. Echoing again the appreciation of the excellent support from Spain leadership, the technical team, and all the actors included. In terms of our understanding, we do hear the concerns coming from the regional government, and as DG indicated, we are doing everything possible to understand the risk. As of now, well, we know the two confirmed cases and suspected have been evacuated. The ship is doing everything possible to take the public health measures. So the overall risk that from our side is minimal, but we know that people have a long incubation period. So we have a clear guidance working with our ECDC colleagues on the ship and the authority in Spain understanding the risk reduction measures. So we have clear disembarkation plan that will not add additional risk. So we are taking all the measures required to reduce. As overall our assessment, and we'll get more details from the team on the ship, it's a low risk. So we are coordinating with our ECDC colleagues, with the UK, with the Netherlands, with all the countries who have passengers on the floor to understand a common way. One is to reduce a further spread of the disease, which we see is limited, and then have a common understanding, a common approach based on public health and evidence, solidarity and equity. I think we are in touch with them and will resolve the logistic issues and the guidance required to implement this and reduce and take any considerations and feedback from the community, the regional government. Once again, we thank the federal government for the excellent support.
Thank you very much, Abdi. For the second part, we go to Maria van Kerkhoff.
Okay.
Oh, pardon me. Oh, first.
Yeah, I just wanted to add to what Abdi said. Based on the international health regulations guidance, we have made a request to Spain, and I have actually sent a letter personally to His Excellency the Prime Minister. And based on that request, because this is part of the IHR regulation, the Prime Minister have accepted. But one thing I'd like to address here is, on top of the the guidelines in the HR regulation, solidarity is the most important here, and that's what the Prime Minister has shown. But on top of that, I think everybody has the moral duty to take care of the people who are on the ship. So I hope those who have concerns at the Canary Island will understand and support and cooperate with the federal government. Of course, we understand their concerns, but as I said in my statement, based on the risk assessment that we have, the risk to the people in the Canary Island is actually low. So the ship is now sailing to Canary Island, and I hope all the support will be provided. And thank you.
Thank you very much, Dr. Tedros. Second part, we go to Maria Van Kerkhove, Acting Director, Epidemic and Pandemic Management.
Yes, thank you. So I believe the second question was related to a potential suspect case. So as the DG said in his remarks, we're getting reports of suspect cases or potential suspect cases. These are alerts, as we call them. Some of them have had reported links to the ship or passengers on the ship. All of those will be followed up with the relevant authorities in each country. The countries themselves, whether it's through the ministries or through the agencies in the countries, are actually assessing each person case by case, looking at what type of exposure did they have, are they developing any symptoms, if anyone is developing symptoms, to be isolated immediately, testing to take place, and providing the appropriate support. This is actually how the case in Switzerland was identified. Following the notification from the ship's operators, which we're very grateful for, this individual presented to healthcare, wasn't feeling well, was immediately isolated, was tested. This is actually public health actions in the works. And I did just want to add on the global solidarity side of things, you know, in all of the efforts that we're doing right now, including the ship sailing to the Canary Islands and to support the Spanish authorities, we've pulled together all of the global experts related to hantaviruses, in particular the Andes virus, and that global solidarity also falls into place on the technical side of things as well, coming in together saying, what do we know, what have we learned from past outbreaks, what's going on in the current situation, and essentially how can we help? And that type of technical solidarity is really helpful. Some of the diagnostic kits and the reagents that we are sending are also going to Spain, so that will support in some of the further investigations that need to take place. So overall, we're very grateful for all of those who've come together from the technical side as well to support this event.
Thank you very much. Next question goes to Nina Larsen from AFP. Nina, please go ahead.
Yes. Hello, can you hear me?
All well.
Great. So I was going to ask if you, would you consider this outbreak to be an epidemic? And also, what would you say about people wearing masks? Should people be wearing masks? Is it considered to be airborne? And also, how long should contacts remain in isolation to avoid further spread? Thank you.
Thank you very much, Nina. And we go back to Dr. Van Kerkhove.
Yeah, so thanks, Nina. So what we have is, you know, obviously the situation that's happening on the ship itself and the follow-up of the contacts of the passengers who disembarked in St. Helena. So far, as you've heard, we have 8 cases so far, 5 of whom have been confirmed, 3 who have sadly died. We have no further symptomatic patients who are on board, or passengers or crew on board, I should say, which is a good sign. But of course, there is a long incubation period of the Andes virus. We know on board they have taken some precautions to try to minimize the risk. What they have advised on board is disinfection of the rooms. They have confined people to their cabins and providing food and water. And they have asked, as a precautionary measure for anyone leaving their room, to wear a medical mask. We certainly advise people who are caring for those who are suspected of this Andes virus or hantaviruses to wear a higher level of personal protective equipment. That guidance has been given to the people on board, but also there are the 2 patients that are in hospital in the Netherlands, and there's a patient in ICU in South Africa. And I am very happy to say the patient in South Africa is doing better, and the 2 patients in the Netherlands we hear are stable. So that is actually very good news. So we have a situation that we are monitoring very, very carefully. These numbers may change. As we're doing follow-up, we may see some additional cases be reported, and that shows that the active follow-up is happening and that the testing is being done. What we know about transmission, and there's been a lot of questions posed to us about, you know, what is actually happening. What we do know is that the Andes virus, in previous outbreaks, there has been instances of human-to-human transmission, mainly among close contacts, either providing clinical care or people who have had close physical contact. And we believe that's happening and has happened in the case here on the ship as well, between the couple, the first and second cases, and also a medical doctor providing care. As you probably know, those who develop symptoms, those who go on to develop disease, sometimes develop very severe disease, which includes severe respiratory disease. So there may be some coughing, there may be some aerosolizing procedures that may be done. And of course, that's where we would require higher level care. So this is not COVID, this is not influenza, it spreads very, very differently. So there are different precautions that people are taking. So we are supporting the ship's operators in the mitigation measures that they are putting on board. And as we've said, we are working to have a proper and full disembarkment procedure step by step to support authorities in the Canary Islands for the next stage of the people who are on board.
And Dr. Mahmoud, please.
No, there was the second part of the question about whether this is an epidemic or pandemic and all the things going on social media. I just wanted to address the situation. What makes unique here is similarity crowded in a confined space. We had a similar situation in Argentina in 2018 to 2019 when a symptomatic individual attended a social gathering. So that led to a lot of people getting infected. So we are in a similar situation right now, a cluster in a confined space with close contact. Does that mean the rest of the world, this disease will spread? We had that outbreak in 2018 and it led only 34 cases. We may have similar cases from there. So I just want to show that if we follow public health measures, and the lessons we learned from Argentina now is shared across all countries, what needs to happen in contact tracing, isolation, we can break this chain of transmission, and this doesn't need to be a large epidemic. It's in a specific confined setting where people are interacting in a prolonged close contact. So we feel it's quite familiar to the 2000 outbreak in Argentina, and we don't anticipate a large epidemic. With the experience our member states have and the actions they have taken, we believe that this will not lead to subsequent chain of transmission. But we need to be balanced, reasonable, supportive solidarity in containing this outbreak in a difficult environment that's happening there. Been in the weeks after weeks there, it's difficult. So the solidarity required and the support, most of the people there, as DG said, are healthy individuals who are going with their lives. So is the public health measures able to break down the chain of transmission? And we believe this will be a limited outbreak if the public health measures are implemented and solidarity is shown across all countries.
Thank you very much, both. Next question goes to Christiane Ulrich from DPA. Christiane, please go ahead.
Yes, thank you very much, Christian. My question goes in the same direction, but a little bit further. We are 6 years out from the Corona pandemic. This also started with very few cases, and you experts know how this is different, but we and our readers might not. I was wondering whether one of you can outline specifically how this is not comparable to the early days or weeks of the Corona pandemic, and why the risks are lower than they were 6 years ago with Corona. Thank you.
Yeah, good comparison. Let's see if it is one. Dr. Van Kerkhoff, please.
I'm going to start, and then I'm going to ask our expert here, Anais, to come in, because this is not coronavirus. This is a very different virus. We know this virus. Hantaviruses have been around for quite a while. There's a lot of detail that we know. I'm going to ask Anais to come in and say this, but I want to be unequivocal here. This is not SARS-CoV-2. This is not the start of a COVID pandemic. This is an outbreak that we see on a ship. There's a confined area. We have 5 confirmed cases so far. We completely understand why these questions are coming, and we are trying to provide all of the information that we can. That's why we're having a press conference here to give accurate information, and we're grateful for all of those who out there who are asking these types of questions. But this is not the same situation we were in 6 years ago. It doesn't spread the same way like coronaviruses do. It's very different. It's that close, intimate contact that we've seen. And most hantaviruses don't transmit between people at all. Most hantaviruses are transmitted from rodents or their feces or their saliva in their droppings to people. And only this one particular virus, the Andes virus, which has been identified here, we've seen some human-to-human transmission. And again, I want to reiterate, the actions that are being taken on board are precautionary to prevent any onward spread. And so there's a lot that is being done right now to be able to try to minimize the risk even further. But I do want Anais to come in and provide a little bit, no? Okay, oh, okay. Thank you.